Good day, everyone. I am DIGOXIN and I am here today to talk about my autobiography. My generic name is DIGOXIN. The brand names under me are AGOXIN, Cartiacin, Cardiogoxin, Celoxin, Centoxin, Digocin, Digazolone, Digocargy, Digoxina, Eudigox, Lanacordin, Lanacryst, Lanadicor, Lanicor, Lenoxin, Cardioxin, and Cardoxin. My drug classifications are as follows. As a therapeutic drug, I am an anti-dysrhythmics V and inotropic agent. As a pharmacological drug, I am a cardiac glycoside. I am of natural sources, and my pregnancy category is category C. Mechanism of action. I have two principal mechanisms of action which are selectively employed depending on the indication. The first one is positive ionotropic. I increase the force of contraction of the heart by reversibly inhibiting the activity of the myocardial NAK ATPase pump, an enzyme that controls the movement of ions into the heart. I induce an increase in intracellular sodium that will drive an influx of calcium in the heart and cause an increase in contractility. Cardiac output increases with a subsequent decrease in ventricular filling pressures. The second mechanism of action is an AV node inhibition. I have vagomimetic effects on the atrioventricular node. By stimulating the parasympathetic nervous system, I slow electrical conduction in the atrioventricular node, therefore decreasing the heart rate. The rise in calcium levels leads to the prolongation of phase 4 and phase 0 of the cardiac action potential, thus increases the refractory period of the atrioventricular node. Slower conduction through the AV node carries a decreased ventricular response. Another use of mine is to induce fetal death prior to a second trimester abortion. I kill the cells and poison the tissues of the fetus. Pharmacokinetics. In absorption, I am approximately 70 to 80% absorbed in the first part of the small bowel. The bioavailability of an oral dose varies from 50 to 90%. However, oral gelatinized capsule of mine are reported to have a bioavailability of 100%. Tmax, or the time to reach the maximum concentration of mine, was measured to be 1 hour in one clinical study of healthy patients taking 0.25 milligrams of digoxin with a placebo. Cmax, or maximum concentration, was 1.32 positive negative 0.18 ng over ml minus 1 in the same study. The area under the curve was 12.5 positive negative 2.38 ng over ml minus 1. If I am ingested after a meal, absorption is slowed, but this does not change the total amount of absorbed drug. If I am taken with meals that are in fiber, absorption may be decreased. Distribution. I am widely distributed in the body and is known to cross the blood-brain barrier and the placenta. The apparent volume of distribution of mine is 475 to 500 liters. A large portion of mine is distributed in the skeletal muscle, followed by the heart and kidneys. It is important to note that the elderly population, generally having a decreased muscle mass, may show a lower volume of digoxin distribution. Metabolism. About 13% of me is found to be metabolized in healthy subjects. Several urinary metabolites of digoxin exist, including dihydrodigoxin and digoxygenin bisdigiti- bis- bisgidi- bisdigitoxoside. Their glucuronidated and sulfated conjugates are thought to be produced through the process of hydrolysis, oxidation, and additionally conjugation. The cytochrome P450 system does not play a major role in digoxin metabolism, nor does this drug induce or inhibit the enzymes in this system. Excretion. The elimination of mine is proportionally to the total dose following first-order kinetics. After IV administration to healthy subjects, 50 to 70% of the dose is measured excreted as unchanged digoxin in the urine. Approximately 25 to 28% of me is eliminated outside of the kidney. Biliary excretion appears to be of much less importance than renal excretion. Indications. I am used to treat heart failure, usually along with other medications. I am also used to treat certain types of irregular heartbeat. Treating heart failure may help maintain your ability to walk and exercise and may improve the strength of your heart. I belong to a class of medications called cardiac glycosides. I work by affecting certain minerals inside heart cells. This reduces strain on the heart and helps it maintain a normal, steady, and strong heartbeat. Contraindications. I am not used if the patient has the following conditions: acute myocardial infarction, hypersensitivity to the drug, ventricular fibrillation, myocarditis, hypomagnesemia, hypokalemia, and Wolff-Parkinson-White syndrome. I require caution if used in cases of hypercalcemia, renal impairment, diseased SA node, bradycardia, AV block, restrictive cardiomyopathy, constrictive pericarditis, and thyroid diseases such as hypothyroidism, which leads to delayed drug clearance, and hyperthyroidism, which does the opposite. I may present interactions with the following drugs: azole antifungals, macrolide antibiotics, rifampin, dronedarone, loop diuretics, quinidine, and intravenous calcium products. Side effects. The more common side effects that can occur when I am taken include diarrhea, dizziness, and headache. If these effects are mild, they may go away within a few days or a couple of weeks. If they're more severe, then go talk to your doctor or pharmacist. Serious side effects. Allergic reactions, which symptoms can include skin rash, hives, itching, swelling of your face, lips, or tongue, and trouble breathing. Changes in vision. Symptoms can include blurred vision with a yellow-green tint. Mental changes. Symptoms which can include inability to think clearly, anxiety, depression, and hallucinations. Neurological problems, which the symptoms are confusion, changes in behavior, feeling lightheaded or faint, and headache. Lastly, gastrointestinal problems, which are the following: nausea or vomiting, persistent stomach pain, fast irregular heart rate, unexplained bleeding or bruising, and unusual weakness or tiredness. Nursing responsibilities. Before I am given, the nurse should monitor apical pulse for 1 full minute before administering. In pediatric patients, the heart rate varies in children depending on age. Ask healthcare professional to specify at what heart rate should I be withheld. Monitor blood pressure periodically in patients receiving IV digoxin. Monitor ECG during IV administration and 6 hours after each dose. Notify healthcare professional if bradycardia or new arrhythmias occur. Observe IV site for redness or infiltration. Monitor intake and output ratios and daily weighs. Before administering initial loading dose, determine whether the patient has taken any digoxin in the preceding 2 to 3 weeks. During the time that I am given, the nurse should not confuse lanoxin with levothyroxine and naloxone. And per RM, the administration of oral preparations consistently with regards to meals. Tablets can be crushed and administered with food or fluids if the patient has difficulty swallowing. Use calibrated measuring device for elixir. Calibrated dropper is not accurate for doses of less than 0.2 ml or 10 mcg. In intramuscular, administer deep into gluteal muscle and massage well to reduce painful local reactions. Do not administer more than 2 ml of digoxin in each intramuscular site. Intramuscular administration is not generally recommended. After I am given, the nurse should create a family teaching plan or a patient teaching plan, which includes instructing the patient to take medication as directed at the same time each day. Teach patient to take pulse and to contact healthcare professional before taking medication if pulse rate is below 60 or above 100. In pediatric patients, the nurse should teach parents or caregivers that changes in heart rate, especially bradycardia, are among the first signs of digoxin toxicity in infants and children. Review signs and symptoms of digitalis toxicity with patient and family. Instruct patient to keep digoxin tablets in their original container and not to mix in pill boxes with other medications. May look similar to and may be mistaken for other medications. Thank you for listening, and I hope you all have a good day.